Good. All right, well, good afternoon, everyone. Let me first of all thank you all for being with us again today. Glad to have Dr. Toomey with us and Director Stallings. They'll be giving you an update here in just a few minutes, and all of us will be available for any questions you may have when we wrap up. I also just want to thank Commissioner Judy Fitzgerald from the Department of Behavioral Health and Developmental Disabilities for being with us today. I know Commissioner Amy Jacobs from DECAL, the Department of Early Care and Learning, will be joining us here in just a little bit. And I also wanted to just acknowledge our state school superintendent, Richard Woods, and his team for their help and collaboration here over the last several weeks as we've been continuing to work on our vaccine distribution plan. I just wanted to start by pointing out a few COVID-19 trend lines that we're seeing in the state. We are now at a little over 2,100 patients in our hospitals with COVID-19. That's roughly 13% of our hospital census. Throughout our battle with COVID-19, this has been among the most important data points the whole team, myself included, has paid attention to. It is certainly welcome news to all of us, and I just wanted to take a moment and thank all of those hospital partners and, of course, their dedicated workforce, the nurses, doctors, staff, administrators, all the way down. You all have done incredible work, and we can never say thank you enough for what you have done. One of the most important things we did since the beginning of the pandemic, in my opinion, was to hold regular calls with our hospital CEOs in the metro Atlanta area, as well as those across the state, to hear what they were experiencing in real time on the ground here in the great state of Georgia. This feedback has been invaluable for us on things like PPE supply needs, bed capacity, testing issues, and a wide variety of other critical information. To all of the CEOs and staff who participated on those calls, I'd also like to say thank you. We also recognize the need for statewide coordination of all COVID-19 patients and bed capacity. That's why the state, with the support of the General Assembly, funded last year and continues to fund this year for the Georgia Coordinating Center at Grady. This air traffic control for hospitals provided essential guidance for facilities looking for beds across the state. And I'd like to thank the team at Grady for partnering with us on that. That coordination was paired with augmented staffing for both hospitals and nursing homes to the tune of several $100 million of investment on part of the state and the Department of Community Health to make that happen. And finally, thanks to the team at the Georgia World Congress Center for their willingness to partner with us and provide beds to patients in need. The World Congress Center, as you all know, was a key part of our strategic plan to ensure every COVID patient had a hospital bed when they needed it. I appreciate their sacrifice for doing their part, and I'm happy to say we'll be winding down that operation in the coming days in light of decreased hospitalization and lower demand for that additional capacity. While the media was quick to write about increased hospitalizations, the success of the state's hospital bed capacity plan to combat COVID-19 will not make the headlines, and that's because this plan worked. There is no doubt that there were dark days and tough decisions made, but yet again, the people of our state, the frontline healthcare workers and hospital staff, and the state agency team we have here in state government pulled together and pulled through. They answered the call and went above and beyond the call of duty to serve their fellow Georgians, and for that, I will always be incredibly grateful. Other trend lines continue to move in the right direction. Cases and the percent positive of tests are all at their lowest level in months. And speaking of tests, I want to give a shout out to Dr. Toomey and her team and all the public health workers and private providers who administered a staggering 7.1 million PCR tests here in Georgia and over 1.3 million antigen tests. And thank you to the providers and public health districts who are continuing to balance testing and vaccine administration to ensure we are staying on top of any emerging issues with community spread of the virus. As we know, the fight is not over yet, but we are certainly moving in the right direction. On the vaccine front, we have now administered nearly 1.9 million vaccines to 1.2 million Georgians. With the current 1A plus population numbering just north of 2 million, we have surpassed well over half of our current eligible population. Given that some shipments were delayed for weather last week, our percentage of administered is now at 81%. There have also been approximately 34,000 veterans vaccinated in Georgia, and I'd urge these Georgia heroes to contact their caseworker at the VA to ensure they receive vaccination through the federal program. As you remember, it's been a little over 2 months since the first vaccine was administered here in Georgia. On December 14th, Dr. Toomey and I were there in Savannah to celebrate this miracle of modern science, but to also ensure the state was prepared to get every dose administered as quickly as we could. Since that day, my top priority has been to protect the most vulnerable and get Georgians back to normal. That's why we expanded our vaccination criteria early on to include those over the age of 65, who account for 77% of all deaths due to COVID in Georgia. As of today, we have administered at least one dose to 800,000 seniors. That's over 57% of our estimated 65-plus population in Georgia. By following the science on Georgians most at risk of severe illness, hospitalization, or death, I believe that we have saved lives and protected our most vulnerable. Dr. Toomey and I have been very clear. While vaccine supply has been so limited, doses had to be prioritized for those high-risk Georgians and those on the front lines of providing vital health care or public services to our local communities. Since mid-January, we have seen a 70% increase in doses sent to the state, which has allowed us to make significant headway in the current 1A plus population. I have been encouraged by recent vaccine allocation updates the Biden administration has provided, and our team feels confident that we will continue to see steady increases in our allotment over the next several weeks. The progress of the Johnson & Johnson vaccine, the increased production of both Pfizer and Moderna have announced, along with positive developments from the federal government, have led Dr. Toomey and her team, in coordination with our office, to feel confident expanding Georgia's current vaccine eligibility. But before I go into that, I'd like to start by saying that we will continue to see more demand than we have supply. Appointments may continue to be hard to find and schedule, and I will say there is no doubt that state government, private providers, and public health officers across the state have learned a lot and adapted over the last few weeks. That is why we have rolled out state-operated mass vaccination sites and why Dr. Toomey and her team have launched a new scheduling tool for public health districts across the state, which she will update all of you on here in just a few minutes. Again, I want to reiterate there will be more demand for the vaccine than the state has supply. With the expanded criteria we are announcing today, I continue to ask Georgians for their patience. Given the steady increase in vaccine supply and the significant progress made in getting more doses administered, today we will be taking another step to protect the most vulnerable and get Georgians back to normal. Starting March 8th, we will expand the current 1A plus vaccination criteria to cover more high-risk Georgians, including adults with intellectual or developmental disabilities and their caregivers, as well as the parents of children who have complex medical conditions. Many of the parents or caregivers of these Georgians have reached out to me personally, to my office, and to the Department of Public Health. Many have had to stay sheltered in place for months on end for fear of infecting their loved one or spreading the virus themselves. I have read those stories. I cannot imagine what they have had to go through. Marty, the girls, and I continue to pray for these families. Additionally, I believe it is vitally important for more Georgians to return to normal. For too many parents, this is simply impossible to do while your child is home learning through a screen. Virtual schooling is leaving too many children behind, and parents are literally at wits' end. They are also very exhausted. We must have every student back in the classroom 5 days a week, statewide. To ensure that happens as quickly as possible, effective March 8th, pre-K, K through 12, public and private school teachers and faculty, and the Department of Early Care and Learning educators and staff will now be eligible for the vaccine. We cannot say thank you enough to our teachers, school staff, administrators, early childhood educators, and countless others who have persevered through these truly unprecedented times. The vast majority of these hardworking Georgians have been in the classroom since last fall, and I appreciate the school systems and early learning and daycare facilities who have adapted and put interests of their students and children first. Whether in person, hybrid, staggered, or online only, each local school system did what they thought worked best for their communities. And as a local controlled governor, I respected that decision. But moving forward, we cannot delay full in-person learning any longer. Our children cannot afford to wait until fall. The costs are simply too high. Georgians deserve to return to normal as soon as possible, and that will not happen without schoolhouse doors open for face-to-face instruction each and every day. For the next 10 days, educators, school staff should work with their administration to ensure their district or school has been in contact with the State Department of Education and the Department of Public Health. This partnership will help ensure systems are able to identify and coordinate vaccinations for interested school staff quickly and efficiently. Finally, later in the month of March, provided that the supply continues to increase and the March 8th expansion goes well, we will plan to further expand vaccination criteria to include more Georgians with severe underlying health conditions who are not currently eligible as seniors over the age of 65. We will be finalizing that timeline and the Georgians affected in the coming days. Let me again recap. Effective March 8th, the following groups will be eligible for the vaccine: K through 12 educators and school staff. This includes both public and private schools. Pre-K and decal educators and staff. Adults with intellectual and developmental disabilities, as well as their caregivers, and parents with children who have complex medical conditions. This population of approximately 1 million Georgians will join the current 1A plus population of roughly 2 million Georgians. To avoid confusion regarding phases and what different states and the federal government are labeling each population, we will not be using 1A plus or 1B for new expanded criteria. To ensure it is simple and easy to understand, Dr. Toomey's team will be listing those who are currently eligible as we move forward with expanding criteria. The Department of Public Health will continue to work with providers to ensure their criteria is up to date and will be followed in the administration of the vaccine. I'll close by saying this: Georgia will get back to normal. We will protect the most vulnerable, and we will beat this virus. These vaccines are a miracle of modern science that will get us back to a regular way of life, and we will utilize every state resource to ensure anyone who wants to be vaccinated gets that opportunity as soon as possible. At this time, I want to turn it over to Director Stallings to give you an update on our mass vaccination sites and pre-registration for new criteria coming online March the 8th. Director Stallings.
Thank you, Governor. First, we'd like to say we're very proud that this week at our mass vaccination sites, we've been able to vaccinate over 11,000 people in the first 3 days. So we're excited about the turnout, the use of the website, and we continue right now to be putting vaccines in arms. As the Governor said, we are updating the site. If you go to myvaccinegeorgia.com, you can go there now and pre-register. If you've already pre-registered as we ask, you'll begin to receive update your status, if eligible, notifications. You'll be led to the update screen where the site is already prepared to receive you based on these new criteria released by the Governor today. You'll simply select what category you fall under and finish your registration. Once in that registration is completed, you'll fall into the appointments category. So you'll be held until March 8th. Once March 8th rolls around, you'll be given the opportunity to begin scheduling your appointments. So no need to do anything more than that. If you've not registered, simply go to myvaccinegeorgia.com, click that yes, you're now eligible. You'll go through the registration process, select what criteria you fall under, and you'll roll over into that same waiting point where you'll be notified effective March 8th that you'll be eligible. I want to make a point about Albany. We've been very excited to see the turnout that we've received. We are asking now, beginning next week, due to the turnout, that we go back to appointment only. The drive up has been very successful this week, but we're now starting to get to the point where we're exceeding our allocation, and we're afraid that those that went through the process and did make an appointment, we don't ever want there to be an opportunity for them to show up and not have the opportunity to get a vaccination. With that said, if you have an appointment and you've gone online to myvaccinegeorgia.com and you've got an appointment, there's no need to show up at 4 a.m. and get in line. At a couple of our sites, we've had folks showing up very early thinking that there's the possibility they might not get their vaccine, but if you've got an appointment, we've got a vaccine for you. What that's causing is, in the morning times, there's a little bit of a backup, and then in the afternoon, we're kind of running empty, so we're ahead of schedule. So show up at your appointment time, we'll get you taken care of. We've got pretty efficient at all our sites, so no reason to get there way early. Your time is valuable to you, and we want to take care of you. I told you the other day we were going to try to get it down to under 6 minutes if we could. It was nice to see yesterday afternoon we were down to about 3.5 minutes worth of wait time at our Delta site here in Atlanta. So we're excited about what we've got going on. But the website is updated, and you can go there now and begin your pre-registration process. Yes, sir.
All right, well, thank you, Director. I'm going to now turn it over to Dr. Toomey. She's going to give you a quick update as well.
Thanks so much, and it's good to see you today because I think this is such great news for Georgians and Georgia. I'm the only one on the team that has this problem, you know. Okay, got it. Thank you. As the governor said, we're seeing, significant improvements in our numbers in test positivity, around 10%, which is quite a bit lower than it was. That's good news. And the statistics he presented are very encouraging. We hope we can continue to see that. The one thing he didn't mention is that in our long-term care facilities, we are seeing a decline in the number of outbreaks and the number of cases we are seeing. Now, if you remember, in days past, I used to say, when I talked about outbreaks, the long-term care facilities were the locations of the highest number of new outbreaks. And that change clearly reflects the fact that we prioritize those facilities as vaccination sites. And we really hope that we can encourage additional long-term care facility staff, as well as other healthcare workers who chose not to be vaccinated in this first round to be vaccinated, even as we move into the next phase. As far as the scheduling tool, we are rolling that out today in an incremental way. This is the same tool that was made by Microsoft that we used, but with some additional added attractions. We use them for testing. We will be rolling them out incrementally between now and the 8th, and by the 8th it will be statewide. And we'll be giving you more information about in the days ahead. I want you to know that it's starting today in selected sites and will be incrementally rolled out until the 8th, at which point it will be a statewide Microsoft Dynamics scheduling tool for all the public health sites. It will not allow you to schedule for Director Stallings sites, nor will allow you to schedule for non-public health sites, but it's for all of our public health sites, whether they're mass vaccination sites or in the health departments themselves. You know, our reporting in GRITS has improved significantly, but we are moving very rapidly to get a new tool for vaccine management and reporting that will be more complete and allow more complete reporting and faster enrollment, as well as better communication tools, both to public health and to the providers. And we are anticipating that will be completed by April, if not sooner. And we are pleased that not only that the 81% of our doses have been currently used, but that so many of our current population at risk, 65 and older, have already been vaccinated. And having said that, I wanted to remind everyone that we are doing a lot of this work with the help of a significant number of partners. And even as we reflect on the fact that 52% of older adults have already been vaccinated, we still have more to reach, even as we're building on the partnerships we have with the schools. And that partnership we have with the Department of Human Services, the areas on aging, the other service providers to the elderly, will continue to be working with public health, even as we roll into the next phases and expand the vaccination criteria. I also want to note that our public health districts have been actively engaged with the superintendents of schools to ensure that there's a plan, and many of them are in fact participating with them to ensure that the school nurses themselves can do vaccinations, or that they can be vaccinated at one of our sites or Director Stallings sites. And those plans are underway and will be completed well before the time of this rollout. I had a couple of other shout outs. One is about our Delta collaboration. I was there yesterday. It was very exciting to see that wonderful site that Delta has provided, as well as the fact that Delta will soon be providing vaccinations within one of their facilities that will be accessible by walk-up and by bus. And this is a tremendous, I think, a twofold win. This is providing important services to a community at risk in that South Fulton and Clayton area, but also, and just as importantly, it reflects the fact that these kind of corporate partners can provide tremendous leadership in the community to ensure that everyone understands the importance of vaccination, to help us expand our reach, both in public health and the private sector medical community, and ensure their own staff, as well as the broader community, sees the importance of this and joins with us as part of these efforts. And so I really want to, again, thank Delta for the role that they've been playing, and also as we continue to build partnerships with the broader business community. These are some of the value added that we can build on to expand the credibility of vaccinations and also expand our capacity to deliver a vaccine to their employees as well as to the communities throughout the state. And finally, I wanted to give a shout out, even as we're talking about protecting lives and livelihood through all these business collaboratives, another shout out to our public health workers throughout the state. They are continuing to work diligently, continuing with testing, continuing with vaccination, but also with many other public health activities. And I was reminded of that when I returned from the Delta site visit. Our neighbors were talking about the fact that there was concern about a coyote that they had seen who they thought was rabid. And I'm sure many of you don't realize that throughout the state of Georgia, most of the rabies agents for the counties are actually our public health environmental inspectors. And if that coyote is ever captured, its head will go to our own public health laboratory that is currently testing for variants and doing other COVID testing, and that rabies testing will be done there. And this is just ongoing, just public health business every day, even as we continue to ramp up our efforts in our COVID response. So thank you, and many thanks to public health, and thank you today for giving me this opportunity.
All right, well, thank you, Dr. Toomey. And again, we got obviously Dr. Toomey here, Director Stallings, Commissioner Jacobs is with us now, and Commissioner Fitzgerald, and we'll open it up for questions.
Real quick, questions over here, please.
Just to be clear, do you anticipate in working with the school superintendents that you'll be bringing the vaccines to the schools to make them available on site for the educators who want to take them?
Again, we're going to kind of rely on local control on that, John. What many of the school systems already housed with Dr. Looney yesterday in Fulton County. They already have a plan to do vaccinations that is ready to go. A lot of school systems are going to work with their local public health department to do that. Others may give the shots themselves with their school nurses. So that's why we need them to coordinate with the Department of Education and the Department of Public Health. And we'll figure out, working with them, you know, if they have a plan or a way they want to do it, we'll help facilitate that. If they need help putting that together, I think that's where Dr. Toomey's team and our public health districts and counties can work with them to do that.
You spoke last week about vaccine hesitancy and how it's important for the state to move ahead and open this up to more people who do want the vaccine. What are you hearing from teachers now, since that survey said that overall 45% of those who responded did only 45% of those who responded wanted the vaccine?
Well, I haven't heard a whole lot more since that. You know, the team may be able to fill you in on any more data that we've had with systems that hadn't filled out the survey or missed the deadline as to what they're saying. I mean, obviously there's vaccine hesitancy in different segments. We saw it in our long-term care facilities. We saw it in a lot of our hospitals, and we certainly saw it in the teacher survey. You know, that was actually a good exercise for us to be able to have that data so we know what we're dealing with, and as we've expanded, it allows us to be able to do this in another measured step forward, which has really been how we have treated the whole pandemic. I'm hoping that, much like other sectors, the more people that get it, when they see their colleagues that have gotten a shot and had no adverse reactions or got through it just fine, that'll continue to lower vaccine hesitancy. We continue to work with a lot of people, you know, a lot of people in the minority community, a lot of people in the business community. Obviously, we'll do that with our educators, school superintendents, teachers groups, and others to work on vaccine hesitancy. But right now, as I said earlier, we still have way more demand than we have supply.
Good afternoon, Governor Adam Murphy. Quick question. Some Georgians have expressed concerns to us about adding additional people to the vaccination list when we're looking at currently 57% over the age of 65 receiving at least one dose. They're concerned about having too much volume and not enough supply and clogging the system. I know today we received some complaints at the vaccination site in Doraville that there was a 3-hour plus wait. Should we be doing this right now, being a bit uncertain about what the supply will be coming in with adding more people to an already clogged system?
Well, to be clear, we're not doing it right now. We're announcing it right now. This won't start